Vaughan Radio. Good evening to all the listeners to Vaughan Radio. This is another edition of Health Talk by the Nevis Renal Society in collaboration with Vaughan Radio. And I'm your host, Dr. Glenville Liburd, here once again to have a chit-chat on why we need to understand your health issues and how to prevent or manage your kidney function, because the Nevis Renal Society is about bringing awareness of renal diseases that will end up in dialysis, and how we can prevent such issues or manage such issues. And so we have been talking about the two conditions that damages your kidneys primarily. There are others, but the two conditions that are so prevalent are lifestyle related. And they're saying, as we live, so we die. So if we live recklessly, with no care or concern about our kidney health, then things can go awry, things can go off track, and then when we do realize what's happening, it is too little, too late, and then it will be a sad day for those left behind, gone too soon. And so those silent killers, we cannot overemphasize the point that those silent killers are taking away people in the prime of life. Anyone who dies before 70 have died prematurely, or I must say before 75 have died prematurely. The life expectancy in St. Kitts and Nevis at birth is now about 76 years for males and about 78 for females. So people are living longer on average. And so if someone dies before the expected life expectancy, then it's a premature death. And you will say 10, that's a biblical narrative. But the statistics are showing that people are living longer, and healthcare has improved generally. And what is taking people now, instead of the acute infectious conditions, are the chronic non-communicable diseases. And leading the pack, you have hypertension and diabetes. And these are two of the silent killers that are so prevalent in our country and worldwide. but in St. Kitts and Nevis, over 10% of the population will have one or two of these conditions. And that's quite a lot. 10% of any population is quite a significant number of persons affected. And the amount of people dying, over 60% of deaths are due to chronic non-communicable disease, diabetes and hypertension, or cardiovascular disease, where these two conditions play a leading role. And so we in the Nevis Renal Society have been going for over 25 years trying to promote awareness of kidney diseases. Because guess what? You could live for a long time on dialysis, we know that. But the quality of life is not what one will enjoy. And unless you have all the money in the world or have good insurance, then it cannot be easily sustained. And even though we raise funds to help those who are going through that experience, we want to prevent it, because they say prevention is better than cure, or prevention is the only cure sometimes. And so, bear with me, please, bear with me, because I've been in this business for over 40 years. I'm giving away my age now as a doctor, right? But yes, I've been at it for that long, trying to understand how to help persons with their health conditions. And having been, as I say, in the trenches and in the mountaintop, you have a fair sense of appreciation of what is going on and how we can manage and prevent lots of health conditions. And you know, it's called for population-wide awareness. Yes, the 1 or 2 persons might do well, but for things to change, then the whole community has to become involved. Because it takes a village to raise a child, and in the same token, it takes a village to heal an adult or to heal the same child. And so we need all of community, all of society to be understanding of what it takes to manage and to prevent these silent killers, diabetes and hypertension. In the previous programs, I've been talking about the need to monitor. And I can't overemphasize that monitoring, surveillance, watching, praying, whatever you want to call it, all have the same objective: to prevent, to catch early, and to put things in place to mitigate and to rehabilitate. But we need to monitor. And how do we monitor? Well, everyone knows themselves. You have your feelings. That's the first level of monitoring. But you have to be aware. So awareness comes first. And if you're not aware, then somebody has to make you aware. That's where education comes in. That's where the society has to be aware. We have to be our brother's keepers. Those who know have to help those who don't know, because education is key, and those who know should educate those who don't know. And that's why I keep coming on these programs time after time, because I've been privileged to have received an education, received knowledge, information, to have gone to university and to obtain a medical degree, to learn about the human body and how it is structured and how it operates and what can go wrong and how to correct what has gone wrong and how to rehabilitate. So the duty is on me to educate my fellow men, my fellow citizens, and that's why Health Talk, programs like Health Talk have been developed, because we need everyone to understand that everyone has a role to play. The whole of society has a role to play in helping our fellow men who, by virtue of whatever circumstance, may fall to the cracks and end up with a chronic condition, a condition where they need extensive, intensive care. But believe me, these extensive and intensive care situations can by and large be prevented or minimized by putting things into place so that everyone can live a healthy, long and productive life for as long as possible. You know, in the global scene, they talk about the sustainable development goals. Having quality health at all stages and all ages of life for as long as possible. And these goals are not randomly developed. They have been born out of years of research and science, and the global community is waking up that we can manage chronic non-communicable diseases and prevent the scourge of diabetes and hypertension. 50 years ago, most people would have died from some infectious condition, pneumonia, tuberculosis, diarrheal diseases, and these by and large have been well understood and things in place to manage infectious conditions. And as we live longer, live healthier, yes, machinery, mechanization has come into place, and so we are living sedentary lives, overindulging, and guess what? We have gone from infectious, communicable to non-communicable diseases as the leading causes of death. Diabetes, hypertension, cardiovascular diseases, cancers, you name it, these are the leading causes of death worldwide. And so the duty is on us to understand these things. And we monitor at a national level, at a global level, at a community level, at the individual level. And so there are doctors, scientists who look at population statistics, data, and give all these fancy figures of how many people are dying from what condition and expected life expectancy and all these things. And they're good. I mean, I quoted some statistics at this already in this program. But let's get down to the nitty-gritty, because at the end of the day, how does it affect me? What do I have to do as an individual to protect my health? Yes, it's good to know about my neighbor, my family, my brother, my sister, but what do I do? Well, be aware. And if you don't know, get to know. Find someone who knows. Come to my office and sit down and let's have a chat. Let's have a conversation. Listen to programs like these. Lots of YouTube videos are out there. Knowledge is everywhere. Some people consult Dr. Google or the AI, artificial intelligence, before they come to us to consult, and they come armed with a lot of information because knowledge is everywhere. But how to apply it is a challenge, and so you still need people with the expertise and the experience to help you navigate through the minefield of information, because you can get confused and overwhelmed and get panicky when you're bombarded with knowledge which may be relevant but not applicable at the point in time. And so there's still a role for experienced operators to help you, individual community, to understand, to navigate how to monitor and apply knowledge appropriately. I have seen people monitoring and charting and documenting the facts and figures but doing nothing about it. You know, and then only when things fall apart then they realize that something's been going wrong. So we have to be able to interpret what we are seeing, interpret the signs of the times, know how to make sense out of nonsense, and how to put things in place to manage what we are seeing, to look at the trends and jump ahead to prevent someone from falling over the cliff, because believe you me, we could be walking into a trap with our eyes wide open if we don't know what we are walking into. And so, monitoring is more than just recording facts and figures, but acting accordingly, acting appropriately, and knowing what these facts and figures mean, and doing the right thing. And if you don't know, consult someone who knows. And that's where we come in as doctors and health professionals, because we have been through the training curriculum to understand these facts and figures and to put them in perspective, and to build network of supportive care, network of doctors and health professionals, nurses, therapists, etc., lab, x-ray personnel, who could help us where we are lacking. No one have all the knowledge at their disposal, so we have to work collaboratively as a team and bring it back again to why we are here. Because some years ago, over 25 years ago, a group of people on this island came together and formed this group called the Nevis Renal Society, because we realized that at that time lots of people were asking for dialysis. There was a good gentleman who managed to have a machine for 7 years or more in his home, because he was fortunate enough to have the means to have such a facility. And people's eyes were open that dialysis is a reality. People can live long with kidney failure once you get dialysis. And that was the impetus for the birth of the Nevis Renal Society, because many people in this little island were traveling all over the world accessing dialysis care, because they realized that with dialysis you could extend life if your kidneys fail. I know of people when I was young growing up who had kidney failure. In retrospect, as I became a doctor, I could understand that they had kidney failure and they just languish away and die. But now that can be managed and prevented, and people are living 15, 20, 30 years on dialysis. Some now are fortunate to get kidney transplantation to replace the kidney, but it's not easy, and so we still need to think prevention. And the Nevis Renal Society is all about prevention at the end of the day. Yes, we like to support those on dialysis. We have the grand dream that one day we'll have dialysis here on Nevis, where people don't have to cross over to any other island to access the care, because you can have it right in your home. Again, it was in a home, a private home here on the island for 7 years. And in some countries, people have their own machine at home. They come from work and they plug up the machine and they go, and they have their dialysis. And so that may come here again in the future, God willing, that we have our sovereign wealth fund. We'll be hearing about that in recent times. Sovereign wealth fund, where money is flowing because sustainable development is coming to the country and money is flowing. And we could have, everyone can have their own dialysis machine. Well, that's a pipe dream. But until such times, we want to prevent. And so, in this conversation, I just want you to understand that we can do it. We can prevent by managing, knowing about diabetes and hypertension. Know your numbers. Stay in your lane. We're driving on a highway, multi-lane highway. You got to know your lane. You got to know when to cross lane safely, where the exits are. And so monitoring is all about knowing your lane, knowing the limitations of tolerance and when to take action. So let's get back to diabetes and hypertension. What are the numbers to observe? Well, for diabetes, a fasting blood sugar of less than 110 milligrams per deciliter, and a 2-hour post meal of less than 160. And for safety, if your sugar goes below 60, you start going into what they call hypoglycemia. So I have developed a simple rule of thumb. 60 to 160, you're laying for blood sugar. Your fasting should not go below 60, and your 2-hour post-meal should not go over 160. So if you learn to test after a meal, because that's when the damage is being done, your sugar goes over 160 at 2 hours after a meal, you are in danger. If your sugar goes below 60, you're also in danger, because we need sugar in the blood. That's the energy source, right? That's how we get our get up and get. That gives us our pep, you know. When we are feeling weak, we take something sweet and we get energized, because it is in the sugar that we consume. So sugar is not all that bad. The body needs it. We need energy. So the energy comes from the sugar, the glucose in the bloodstream. But too much of a good thing can be bad, and too little can also be bad. So the sugar goes below 60, you get weak, confused, jittery, tremulous, you know. Those are signs of hypoglycemia. And guess what? When the sugar is high, you don't know. And that's the danger. High blood sugar is deadly and deceptive. Low blood sugar is open, it is deadly. You can't hide it, but you could hide high blood sugar for a long time. And then when this has done the damage by undermining the structure of the body, you come to a crisis and the system crashes, because the high blood sugar has been undermining the structure of the body. And so that's why we need to monitor your blood sugar after meals. Some people do the fasting only, but I want you to get into the habit of testing 2 hours after a meal, because that's a standard time frame. 2 hours after a meal, it should be less than 160 milligrams per deciliter. So just remember, 60 to 160 for the blood sugar. It shouldn't go below 60, it shouldn't go above 160 at 2 hours after a meal. And then there's a test called the hemoglobin A1C, which gives you the average blood sugar of the last 3 months. That test should be less than 7%. 7% is determined to be tolerable for diabetics. If it goes up beyond 7%, you're in danger. I'm not going to go into the details of the A1C tonight, but we did it before. I will do it again in another program. But the hemoglobin A1C gives you the average blood sugar over the last 3 to 6 months, and it should be below 7%. The normal range is between 4 and 6%, and diabetics are allowed to go up to 7%. But once you get at 7%, you have to take action to bring the sugar back down, the average sugar back down. So know your numbers. 60 to 160 for your blood sugar, 60 for the fasting, and 160 for the 2 hour post meal. And for the hemoglobin A1C, 7%. Better yet, 6%. If the A1C is at 6%, then you know you are in the normal range. So let's keep it all sixes, right? 60 to 160 and 6% for the A1C. And if you keep that 6 in mind, then you know you can't go wrong, right? Easy things to remember, right? I like to keep life simple, you know. So in medicine we have these what they call mnemonics to help us remember all the facts and figures that are out there. So for you, I will say 60 to 160 and 6% for the A1C. Blood sugar, 60 to 160. A1C, 6%, no more than 7%. And then you can't go wrong. And if you do your test, monitor periodically. If you've been diagnosed to be diabetic, you must do some tests at least once every 3 months to know that you are still on track. Because the A1C, every 3 months, if it's still below 7%, then you know that you are managing your blood sugar reasonably well. If the A1Cs keep increasing and the 3 monthly test, then you know you are in trouble. You have to tighten your belt, tighten your diet, get out, get active, go to the gym, go exercising, whatever it takes to bring it back down, and it can be done. And in that way, you will avoid damage to your kidneys, your heart, your eyes, your retina, your blood vessels, your white blood cells. You prevent lots of complications by keeping your blood sugar under control. And so, my friends, this talk tonight, I've been rambling along, but I hope you get sense out of my nonsense. And if you don't understand anything I've said tonight, then I'm not too hard to find. 662-5187 on WhatsApp will catch me any time of day or night, right? If I don't answer right away, just send a text message and I will know you call me, right? And the Renal Society meets the third Thursday of every month at Eureka Health Services building in Ramsbury. If you want to join the society, you can call me 662-5187 and I will get you connected with the membership. I can't remember the numbers of the other members offhand, but I'm a member, a founding member, and I'm proud to say that, of the Nevis Renal Society. And if you want to be part of that organization, then we'll be pleased to welcome you in our group, and then we can continue the conversation one-on-one. You can consult me in my medical practice. You can catch me anywhere in the street. Giving out information is one of my hallmarks. So it takes nothing off me to give you advice free of cost. So, but then there comes a point where you need technical explanation and help. Then you can come and consult and customize it, and we can get you back on track. So 662-5187. You can catch me any time of day or night. And the Nevis Renal Society meet the third Thursday between 5 and 6 p.m. at the premises of Eureka Health Services in Ramsbury for the time being. And I said I am proud to be a member of that group, and they are proud to sponsor this program in collaboration with Vaughan Radio. And with that said, I'm watching the clock on the wall, and I see my technical person watching the clock as well, because another team is lining up to come and share the information. So it's been a pleasure talking to you this evening, and we hope to do it again in another month's time, the third Thursday in every month. After our Renal Society meeting, we come on this radio program and we have a little conversation about health talk and what goes on in the Renal Society and in healthcare in Nevis with your kidneys. So, with that said, Mr. Technician, give us the outro, please. So, we say goodbye and good night. Until next time.
You were just listening to Health Talk